Today I am here to present a case of end-stage renal failure as a complication of generalized atherosclerosis. Under scientific supervisor, Professor Pathlothu Department of Hospital Therapy, Honorable State Medical. Chronic renal failure as a term. Chronic renal failure applies to the process of continuing significant irreversible reduction of nephron numbers. In the clinical case, we had observed a patient in a clinical observation who was directed for consultation of nephrologist with a diagnosis of generalized atherosclerosis with defect of renal vessels, coronary vessels and renal arteries of cerebral cortex and lower extremities also. This patient had renal vascular stenosis with end-stage renal failure. Atherosclerosis, a common disorder characterized by atheromatoous play of cholesterol, other lipids and cellular debris, which are formed within the intima of large and medium-sized arteries, especially coronary, cerebral and renal and limbic arteries, narrowing the arterial lumen and proceeding eventually to fibrosis and calcification. Atherosclerosis. Here you can see the difference between the normal artery and atherosclerotic formed arteries. Syndromes and diseases of atherosclerosis. Ischemic heart disease, cardiac arrhythmias, carotid artery stenosis, peripheral artery stenosis, and coronary kidney disease, vascular hypertension, acute cerebrovascular insufficiency, and thromboembolism, and etc. The risk factors are tobacco smoking, high serum concentration of low density lipoproteins, and low serum concentration of high density lipoproteins. In the age, males above 45 years, women above 55 years. Hereditary mechanism, diabetes or impaired glucose tolerance. Elevated triglyceride level and high sensitivity C-reactive proteins and other inflammatory markers. Systemic effects on arteries, aorta will affect 43%, coronary 29.3%, cerebral artery 14%, renal artery 8%, lower limb arteries are 4.1% and mesenteric arteries are 1%. Complaints. The patient, 61 years old, male, admitted in nephrotherapeutic department with complaints of periodical increase in arterial blood pressure, 250 by 150 mmHg. On admission, complaint on dragging pain in the lower back, pain in the cough muscle while walking, transient abdominal pain, frequent urination at night every 2 to 3 hours. Expressed general weakness, diffuse periodic headache and dizziness. Anamnesis. The symptoms of disease are persistent from the past few years. Periodical increase of arterial blood pressure 290 by 160. On consultation of nephrologist, a diagnosis of generalized atherosclerosis with the defect to renal vessels, coronary vessels, renal artery, artery of cerebral cortex and lower extremities, and ischemic disease of kidney was concluded. Periodically undergoes treatment in nephrotherapeutic department, ischemic heart disease, acute myocardial infarction in 2011, stable stenocardia, functional class 2. Objective status of patient. The general condition is of moderate severity, tolerance to physical activity decrease, general weakness, an auscultation of lung, vesicular breathing, no pathological sounds, rate of respiration 18 per minute, borders of relative cardiac dullness shifted towards left by 1.5 cm, blood pressure 170 by 110, with use of antihypertensive drugs, heart rate 68 per minute, pulse 68 per minute. Abdomen soft, tender in right hypochondrium, kidneys are not palpable. Urination difficult, nocturia, oliguria. Laboratory analysis. General blood analysis, the erythrocyte and hemoglobin levels decreased, and general urine analysis in the protein level increased. Biochemical blood analysis, that creatinine and urea levels increased. Laboratory analysis of electrolytes. The sodium, potassium and calcium levels are normal. Chlorine and magnesium level decrease and phosphorus increase. Lipidogram. In that high density lipoprotein level decrease, low density lipoprotein level increase, and atherogenic coefficient also increase. Coagulogram. Prothrombin index 71% decrease and fibrogen 6.28 increase. Instrumental examination, electrocardiogram. Sinus bradycardia with heart rate 55 per minute. Electric axis of heart is in horizontal position. Signs of left ventricular hypertrophy with hemodynamic overload and left atrial enlargement. Repolarization of left ventricular myocardium. Signs of electrolyte imbalance. Dopplerography of abdominal aorta. Stenotic lesion of celiac trunk over 70% with higher rates of peripheral vascular resistance in the common hepatic and splenic arteries. Dopplerography of renal arteries. In the stenotic lesion of both renal artery, peripheral vascular resistance at both the proximal renal artery at the level of segmental, interlobar and acute arteries of both the kidneys. Ultrasound examination of kidney. The kidney is irregular outline and indistinct shape. Parenchyma thickness 16 mm. Increased echogenicity of parenchyma. Condensed pelvis. The ureter are not dilated. Stones are not defined. Area of left adrenal gland is not changed. Ultrasonography. In the stenic lesion at the level of left and right iliac arteries. Occlusive lesion at the level of femoral and popliteal arteries. Clinical diagnosis. Clinical diagnosis were made on the basis of anamnesis, result of clinical, laboratory and instrumental analysis. Renal artery stenosis, glomerular filtration rate 13.8, proteinuria, increased serum creatinine, change in lipidogram, defect of arteries of lower extremities, acute myocardial infarction in anamnesis, acute cerebrovascular insufficiency anamnesis, and response to antihypertensive therapy, hemodialysis and suppurative therapies. Clinical diagnosis. In that, general atherosclerosis with defect to renal, coronary, cerebral, mesenteric arteries and arteries of lower extremities. Chronic kidney disease stage 5. Glomerular filtration 13.8 per minute. Ischemic disease of kidney. Chronic renal insufficiency stage 2B. Secondary shrinking of kidney, cyst of right kidneys, and third stage of secondary refractory arterial hypertension. Ischemic heart disease, stable stenocardia, functional class 2, cardiosclerosis, atherosclerotic post-infraction, acute myocardial infarction in 2011, dyscirculated encephalopathy of mixed genesis, and second stage of acute cerebrovascular insufficiency. Nephrogenic anemia, medium stage 7. Conclusion. This case demonstrates the stenotic lesion of coronary, cerebral, celiac trunk, lower extremities and both the kidneys. Atherosclerotic plaques in patients with end-stage renal failure are characterized by increased intima media thickness and marked calcification. Deposition of calcium within the plaque may contribute to high complication rate in the uremic patient. Thank you very much.
Jaganlal, you said that your patient was suffering from chronic renal failure, stage 5, right? So, how can you tell that this is stage 5, this is stage 4?
In that instrumental
criteria of stages.
Yeah, nice question. In that instrumental examination, clearly given is that what is the level of protein and what is the level of the ECG, electrocardiogram level, everything is given. According to basis of that, we conclude the patient.
But I think it's written that according to GFR, it's given the
stages. According to GFR also we can say its normal GFR level is more than 90.
Yeah.
But here is
20 ml per minute.
Yeah, level is decreased. 13.5 means it's like 5th stage.
So this is 5. So I want to know what is the range in first stage, how much, in second stage, how much, like that?
Yeah, in first stage we can say below 90. Below 90 up to 60 to 90 we can say that it's the first stage. And according to that we have to reduce up to that 15. We will say below 15 we can say that both the kidneys are damaged.
Okay, so there is 5 stages only. 5 stages.
Yeah, 5 stages.